Okay, Bob, why don't you go ahead and we'll start the grand rounds. I think you've got
Okay.
some mid-teens in the online, and so oftentimes the residents are actually grouped together just with one access point, but there's 10 or people in the room. So you guys go ahead.
All right, fine. Good morning, everyone. I am Robert Silverstein, board certified internist and cardiologist. And today we're presenting grand rounds on basically the prevention and reversibility of multiple diseases simultaneously. It is my pleasure to introduce William Spear, a man of literally international recognition. He has appeared before the U.S. Senate. He's discussed and lectured at Stanford, MIT, presented at the United Nations, has written a book that has to do with the care of people who have been through traumatic difficulties. He's worked at the Yale Living and Dying Center. He is an associate of Elizabeth Kubler-Ross, who has written the famous treatise on death and dying. For those of you who are not familiar with her work, I encourage you to look her up, Elizabeth Kubler-Ross. And he is a close friend and associate of mine who has had an immense influence on me personally and the care of thousands of my patients. To give you an idea, I've been in practice for 50 years, seen 225,000 office visits and patient visits, and William has affected virtually every one of them by his principles. I'm now going to turn it over to William to present, and then we'll return to me. Finally, I have no disclosures, so on to next.
Great. Good morning. Thank you, Bob. Thanks for that introduction. I believe the way to go here for me is to share, if I may, uh, and I will tap that and allow the share screen, and then I should share my entire screen. I will get rid of this, and I should open that, and hopefully the view will be this. Do we have a slide there with Hippocrates' words?
Yes, it looks good. Thank you.
Great. Okay. So, yes, I was at Yale in the mid 70s. And at that time, I walked into Dean Berliner's office, having had some experience in the previous years working with patients who had terminal diagnoses. And my experience was that we changed their diet and lifestyle significantly, and they started to recover and reverse end stage cancers. So I said to Dean Berliner, I thought there was a relationship between diet and cancer, and he promptly kicked me out of his office. He said there was no such thing, maybe nitrates in hot dogs, maybe saccharin, but there was no relationship between sugar or meat or dairy or anything else and cancer and degenerative illness. 4 years later, Dean Berliner became the chairman of the National Cancer Institute study on diet and cancer. They found 60% of cancers in females and 50% in males, at least partially dietarily related. And of course, we've come to know since then that food plays an enormous role. And so, could it be medicine? I'm kind of the food is medicine guy in this relationship, so that when Bob refers patients to me, we change dietary habits and lifestyle significantly. So, what food? Well, there's all kinds of choices. Everybody knows about the Mediterranean diet now and the DASH diet and so many other things that potentially reduce blood pressure or that improve immune function. But there has to be some principle to this. It isn't just following a culture. And so, one of the principles that we base any dietary recommendations on is centering diets around whole cereal grains and fresh local seasonal vegetables. Grains, here are 12 of them, not just rice, but many different grains like quinoa and buckwheat, corn, et cetera, that have very different growing seasons. And the energies that they produce are very different. For example, buckwheat grows in the northern climates. It helps dry the tissues and warm us up, as opposed to corn, which grows in the southern regions, which moisten the tissues and cool us down. So you won't see buckwheat and kasha in diets that people practice in the South simply because nature doesn't present it there. So what does our plate typically look like? Well, here's a similar plate to what I might have had last night or what we might be eating week to week, with a grain in the middle. In this case, it's brown rice, a bean, which is a complementary protein, and then a variety of different vegetables, usually colorful, lightly steamed or parboiled or sautéed. What's interesting about this particular plate is that beyond nutritional biochemistry, there are many energies here. There's an energy of the sea vegetable in the back left-hand corner, hiziki, which happen to have more calcium than a glass of milk. They're beans, which are protein complementary amino acids to the grain. So these many vegetables that we choose will be above the ground, on the ground, or below the ground, and how we choose them might look like this too. It might be a pizza. It might be any kind of pasta dish with vegetables or some kinds of proteins or beans. It might be a soup. And if you look at cultures throughout time, most of them had a soup as a daily food. If it contained some meat or animal products, it would be called a stew. But most often, those soups contained a grain of some sort. Italian cultures be familiar with pasta fagioli. And so here's a corn soup that's typical in Mexico, but there's usually a grain, whether it's barley mushroom soup or lentil soup with rice or a pasta fagioli. There will be a soup in many of the traditional cultures. As far as a plate goes, we'll use energies which also have a varying degree of upward and middle ground and root vegetables. And interestingly enough, that covers surprisingly all the nutritional biochemistry that you need in terms of protein, carbohydrates, and various forms of amino acids, as well as the omega oils, as you saw from the avocado in the background of that previous slide. So pasta dishes or tofu, seitan, those are soybean and wheat products that are extremely high in protein. Tofu, I know something about because in 1979 I started a tofu company since there wasn't any real good or organic soybean tofu available in Connecticut. That company's still in existence today, although I don't have anything to do with it anymore, but it provides tofu and seitan and other traditional foods in the same way that they were years and years ago, centuries ago. These are not mass produced, highly processed foods at all. They're very simple traditional foods. So tofu might look like this on a plate. There's quinoa in the center. Again, various types of vegetables. You have a carrot, which grows below the ground. You have a squash, which is on the ground. You have a green, which is above the ground, and even some pickles and mushrooms, which are quick growing and quick sort. Beans and seeds and nuts also provide amazing amounts of protein. The little revered pistachio nut that's there happens to be the highest nut in protein of any of them. There is, given this talk, a chance to talk about something very different than the approach that most Mediterranean diet or DASH diet conversations would include, and that is the use of fermented foods and the health and gut microbiome that fermented foods like miso, tempeh, sauerkraut, kimchi, yogurt, whatever it may be, every culture on the planet always had some fermented foods. Even the most northern cultures that had no vegetables, those people in the Inuit tribes and traditions would take a whale straight out of the water and slit the stomach open of the whale and dig out the sea vegetables because they knew there was a fermentation that was important for their gut biome. Now, as Dr. Silverstein has been regularly researching and sending me articles on fermented foods and mushrooms and the immunosupportive quality of these things. These are amazing foods, and they should be parts of any kind of dietary approach without respect to trying to figure out how to get your protein or the amino acids or carbohydrates or minerals that are inherent in so many other foods. Here's 5 jars of protein, rather of pickles at our house. They're simple to make. You simply put them in a jar, mix in a little salt, and come back in a couple days. You have some pickles, they don't need vinegar, they don't need sugar. Once I had a woman who came from Ecuador and asked her how to make pickles, and she looked at me like I was crazy. It was very simple. She said, you just put salt and you wait. So here's 5 pickles made from radishes, made from cabbage, cauliflower, cucumbers, and carrots. And they will be fermented foods that improve gut biome. Here's a whole series of 12 different fermented foods, beginning with daikon root pickles, with eggplant pickles, with miso and radish pickles, and so forth. Where are they? Well, all of these 12 pickles can be found in a Chinese restaurant or in a Japanese restaurant, because much of the principal energies that we understand and use in dietary recommendations come from those ancient cultures who really understood the importance of fermented foods, even light, quick fermented foods that are now available in natural food stores. You don't have to make them at home. You can find any of these in packages that are simply made with salt and thyme and nothing else. Mushrooms are also one of these foods that I wanted to talk about a little bit, that tend to be kind of ignored because they're not going to be uh, people aren't going to focus on them for sources of protein or sources of minerals per se, but they have an enormous benefit in terms of anti-cancer, antioxidant, anti-inflammatory, and anti-hyperlipidemic conditions and activities in the body. Traditional Chinese medicine and Chinese mushrooms are very easy to use. They're plentifully found in most natural food stores now, and even some of the major markets are starting to carry things like onaki mushrooms or reishi mushrooms or maitake, and certainly shiitake mushrooms are all readily available. They're easy to use. They can go in salads, they can go in soups, they can go in dishes. And there's more and more evidence, thanks to Dr. Silverstein again, who sends me articles regularly about what has been discovered about the powerful activities of mushrooms included in the diet. So it's not just a question of plant forward, but as Einstein said, we're starting to really see that health increases, and in the bigger sense, incredible chances for survival on the planet by shifting away from so much centralized meat centered diets, highly processed diets, and moving toward local seasonal vegetables as principal foods. We do not shy away from desserts. I counted 105 different cookbooks on my shelf on desserts alone. So whether they're made with fruit and pies or tarts or puddings, cookies or whatever, anybody who's visited my house knows you're going to get a dessert out of the deal too. We enjoy it. We do not use white sugar. One of my teachers said the 3 most dangerous things in the world are sugar, law, and education. I'll leave the last two to for you to think about, but sugar is certainly a food we move away from in any way, shape, or form, and that includes any kind of simple sugar. So we might use fruits as sugars, or perhaps a little maple syrup, or rice, or barley malt, or other sweeteners like that. So, the history of all of this has now brought us to food as medicine. And I want to give you and leave you with a sense of the history of my own more than 50 years looking at how foods and medicine have changed. When I started and was at Yale, the words that were used most often were alternative medicine. And that meant people who were changing their diet, but it also meant people who were using supplements or going to acupuncturists or considering chiropractic or whatever. There was a tremendous number of people using them, and so they started to call it complementary antagonistic or complementary alternative medicine. And over about 5, 6, 7 years, that shifted to holistic medicine, with some sense that we could embrace the human body and mind together as a whole being. That slowly shifted, as we see now, to something called integrative medicine. And almost every major medical center in the United States is considering an integrative medicine center of some sort, which is integrating all those alternatives, whether it is acupuncture or massage or stress relief meditation or others. And this might be called someday collaborative medicine. So, this food as medicine is not a conversation around nutritional biochemistry. That's something very different, but it is an important consideration to look at calcium, protein, iron, omegas, of course. But those are secondary to the understanding of the energies of food and how they might be used in very specific ways for cancer, heart disease, degenerative illness, diabetes, etc. And those principles are too elaborate to teach in this short 10 minutes. But what it really amounts to and boils down to is that this is lifestyle, and lifestyle is indeed medicine. So when you change a lifestyle and you include meditation, you include stress relief, you include uh, cooked general foods which grow in local seasonal conditions, and you shy away from those highly processed foods and focus much more on a plant forward kind of diet, you're really choosing lifestyle as a medicine itself. I look forward to working with anyone who is interested in learning more about some of the principles behind all of this. I know my relationship with Dr. Silverstein has been fundamental in his life, but uh, it goes both ways. His friendship and his support of my own work and family is deeply appreciated. He's a special guy, and I appreciate the opportunity to be with all of you. Dr. Silverstein, Bob, it's all
All
yours,
set?
sir. Thank you.
Okay. Now, am I on screen? Hello?
Not yet, Bob. I just see some redwoods, I think.
That's mine. So I will end my sharing. And I think I did that. I hope.
Yep, your screen's off, Dr. Spear.
Right.
Bob, you need to share your screen now. Yep. There you go.
Okay, fine. Thank goodness. All right. Wonderful. Hang on. Wonderful presentation by William. He is one of the most profound people that I've ever met in my entire life. He is, by the way, directing hang on, we got ahead of ourselves.
There you go.
There we go. He is directing the wellness program development at the New Vance group of hospitals in Danbury and surrounding areas. And his principals are actually in that hospital system. And of course, I'd love to see that happen here. All right, here is my first slide. The title of this talk is A Little Preventive Medicine, Good Cop, Bad Cop. As you might imagine, you just heard the good cop, and now it's my turn. This slide I picked because I think it's entertaining. The key part of this slide is why. Why do people have the problem that they do? Next slide. So the approach that William and I both have is the concept of the simultaneous prevention of multiple diseases. It isn't like you need a different approach for each different disease. It's like they all have the same general origins, and what you're doing is identifying those people who have particular predispositions to develop this, that, or the other condition. So once again, the concept is the simultaneous prevention of multiple diseases. This was said by the head of the National Institutes of Health, and it says it extremely well. Genes load the gun, and then lifestyle pulls the trigger. In a certain sense, that's what I just said. I just said that people have predispositions. That's otherwise known as genetic susceptibility. And then what people do, their choices, decisions, actions are what eventuate the activation of those genes in a direction of disease process. What we're trying to do is this concept over here. We are trying to distill simplicity from complexity. Now, the cause of the causes. What is it that makes diseases occur? Once again, quite simple. First principles, simplicity, as William already said. There are 5 basic activities that generate most diseases, most conditions, and that is what people breathe. Like, do they smoke? Do they vape? Are they using marijuana, which has recently been linked to an increased risk of myocardial infarction? Uh, do they work in dust and fumes without proper masking? Do they have an air purifier if they live near an interstate or other major highway? All of those things are recommended. Now, what is it that's breathing, then comes drinking. The major discussion always there turns out to be alcohol and coffee. Obviously, we should be drinking water, weak herb tea, green tea, white tea. Every morning I have 1 cup of coffee, and then I put in 1 green tea bag, and then I put in 1 white tea bag, and that becomes my second level of drink. So people want to know about alcohol. You know, when you get a cut, people pour alcohol on it to clean it up. Obviously, it's a toxin. I do believe the body will tolerate things that we might view as toxic to a certain point. And now you're into clinical judgment, which we'll address in a minute. The use of alcohol has been defined as dangerous at 1 drink a day for men. I believe that the body will safely tolerate 4 drinks of alcohol. That is a clinical judgment. And what about coffee? Coffee is clearly a kind of open quote dirty water, but on the other hand, the body will tolerate a certain amount of anything once in a while. So I think 1 to 2 cups of coffee a day is probably safe, but I hold judgment on that, recommending again the green tea and white tea. It's not like I'm going to encourage people to drink coffee, but I would say the green tea, white tea idea. And then I made eating third because I didn't want to overload people with any sense of concern from the beginning. So it's breathe, drink, eat. 400,000 cases of coronary artery bypass graft surgery per year in the United States, as opposed to a diet of grains, vegetables, beans, fruit, nuts, and seeds, as William has discussed, and I will elucidate on further. People want to know about exercise. All exercise counts. Swimming is perhaps the best exercise. Then after that, I recommend Tai Chi, some light weight training to approach the concept of abdominal clear lines of definition and demarcation. It is not a particular BMI. It is abdominal clear lines of definition to empty out those fat cells, which are little factories of dangerous cytokines, interleukin 6, C-reactive protein, and so on. Finally, the old phrase, you can never be too rich, have too many black shoes, or be too thin, that is essentially true. As for anxiety and depression, that is mostly determined by people who have unrealistic expectations. That may seem simplistic to you, but when you talk to people who have dealt with their anxiety and their depression, they are into the realities, accepting the realities of the world and dealing with them. So people having unrealistic expectations are as dangerous as alcohol too much. A little bit is okay, but not to be exceeded. Next slide. Oops. Now, these are the people who show the concept of proper muscle, proper percent development. And they show it most clearly here with the abdominal clear lines of definition and demarcation. These people exercise about 80 to 90% of the entire day. These people have figured out in our culture how to do it, but they exercise a great deal. These pre-technological societies all have a total cholesterol of 90 to 130, and I'll show you a slide on that shortly. And they have none of our diseases. They have no matter how long they live. Some of these people live to very old ages, 80s, 90s, and so on. They have no diabetes. They have no cancer of the colon. They have no angina. They need no open heart surgery. The Yanomamo were just studied in the Bolivian jungle, or I'm sorry, the Tsimane, Tsimane, and coronary calcium scores were done on them, and they had no coronary calcium score until very late in life. And you may say, well, why? And I think it's because they inhale the smoke of cooking. Now, this is a study that just came out. The slide was originally furnished by Kim Williams, past president of the American College of Cardiology, and I've updated it. And what it is the global effect of cardiovascular lifetime estimates, and it was published in the March 30th New England Journal of Medicine. And what they did is they looked at people in various countries and cultures. They looked at 1 million people, and they found that the major risk was dietary. More important than smoking, more important than alcohol, more important than not exercising, and so on. 1 million of the people died of all causes, but the major cause of death was cardiovascular, approximately 700,000 of that 1 million. So the concept becomes preventable if curable. As a physician who sees patients and sees referral patients, I'm always astounded that patients are not told that their hypertension is curable, that their diabetes is curable, that their high cholesterol is essentially curable. Same for triglycerides. We are here to get the concept across of stopping diseases before they cannot be stopped. And what do those diseases come from? We already talked about it. Genes interacting with choices, decisions, actions resulting in made to happen conditions. High blood pressure, high cholesterol, high triglycerides, cancer of the breast, uterus, colon, prostate. 95% of atherosclerosis, diabetes, high blood pressure, high cholesterol, and triglycerides are preventable if not curable. Now, when you talk to patients, you must be very empathetic. But on the other hand, Kevin Volpe of the University of Pennsylvania made this statement be true and needs to be said. And you do need to say it. It wasn't done to you, it was done by you. Kevin Volpe showed that of the carrot and stick approach, that the stick was twice as effective as the carrot in getting people to change. I am not saying disregard the feelings of patients. I'm saying be truthful so that they understand the curability of their hypertension, of their high cholesterol, of their high triglycerides, and so on. Oops. Now, William first wrote about heart disease in 1978, and I first published about it in Lancet in 1990 and again in the American Journal of Cardiology in 2003 with the concept of the abolition of symptomatic coronary artery disease. It is a matter of honesty. We are trying to protect patients. We're not seeking perfection. It's about being careful, not paranoid. Forgive me, I keep punching the down button on my computer and the slide doesn't move, and then I have to do it manually. Now, this is part of the curability concept. If you take a group of people and give them a sugar load at time 0, and then you measure their sugar out here at 2 hours, if it comes back 83 at 2 hours, or if it comes back 155 at 1 hour, then they have no future risk for the development of coronary artery disease as far as glucose goes. But what if it comes back 90, 126, or 180? Obviously, the risk starts to go up. Again, it's not about perfection. It's about offering people the chance for freedom. If their sugar comes back 155 at 1 hour, 83 at 2 hours, then they have no future risk, and that should be the goal. I do not agree with the current guidelines for the treatment of diabetes and what constitutes proper sugar control. Now, this is the same thing with cholesterol. With very powerful medications on top of statins, the PCSK9s were given to patients, and they were studied by nuclear magnetic, near infrared spectroscopy. I got that confused. Just learned the phrasing again today. Near infrared spectroscopy, oculocoherence tomography. That is the technique that retina specialists use looking at the retina, but it can also be put onto catheters and put into the coronary artery. Intravascular ultrasound. When you get the cholesterol low enough, and I prefer non-HDL cholesterol. What is non-HDL cholesterol? Well, LDL is one of 3 bad cholesterols. There's non-HDL cholesterol for the total. There's IDL intermediate density lipoprotein, VLDL, very low density lipoprotein, and LDL lipoprotein. Those low density lipoprotein, which LDL is the major determinant of non-HDL, but it's not the total. So I prefer, and it has come into common parlance to use the phrase non-HDL cholesterol. So a non-HDL cholesterol of right around 90, or an LDL cholesterol of between 50 and 65 is where you can actually document that the atherosclerotic plaques begin to regress with depletion of the lipid core and opening of the coronary artery with increasing blood flow. A 1% increase in blood flow results in a 20% reduction in major adverse coronary artery events. So up to this point, you've been hearing something that I've been trying to encapsulate with this. Each of you, including myself, uses clinical insights, and the best clinical insights do exceed so-called knowledge by at least one step. So what I'm saying is clinical insights are often better than the published literature. I sent this phrase to the editor of the Journal of American Medical Association, and he liked it a lot. Doctors guess at every step, and the best doctors have the best guessing rate. And here is a combination of facts, scientific study-based interpretation for what results in the simultaneous prevention of multiple diseases. Take the total cholesterol, subtract the good cholesterol. That number needs to be 90 or less. Triglycerides, 100 or less. A1C, 4.4 up to the age of 44 and not above 6.2 at age 62. That is not what the current guidelines say. That is my clinical judgment and interpretation. We just discussed this. This is fact-based, science-backed, what's called science. Blood sugar, 155 at 1 hour on sugar challenge, 83 at 2 hours, prevents coronary artery disease from developing. Cardiac HSC reactive protein needs to be lower than currently recommended, needs to be 1. Ideal blood pressure, 110 to 115, over 60 to 70 in the walking well. Sodium intake, when people buy canned food or box foods, should be 12% or less. Cancer of the prostate blood test, 1.0. TSH, 3.5, not up to higher than that. Hemoglobin. The higher the hemoglobin, the greater the viscosity. The ideal hemoglobin is around 12 to 14. Above that, you increase viscosity and risk for infarction. Uric acid, about 5.5, clinical insight. BUN, 12 to 14, clinical insight. Magnesium, 2.1 or higher, I find in all of my vegan patients, which tells me that is the natural human body magnesium. When you see a magnesium less than 2.1, you know their diet is not what it should be. And almost all patients with hypertension come in with a magnesium of around 1.8, 1.9, or even lower. Same goes for potassium. You see people with potassiums, untreated, come in with potassiums of 3.8. It needs to be 4.1, and it will be 4.1 on an ideally organic and unprocessed whole foods dietary approach. Vitamin D level, I disagree with Joanne Manson of Harvard. She's lovely in her correspondence with me. I believe that the proper vitamin D level is 50 to 66 nanograms, not millimoles, nanograms per milliliter. And so on for the rest of these. This is available on the website, www.thepmc.org. That is open quote, my quote, website, so you get my insights and guesses. 1 million atherosclerotic events per year, 600,000 mortalities. But don't forget there are other conditions, Mammogard, colonoscopy, Cologuard, and so on. This information supports everything we've said up to now. Let's see, 8:35. This was just presented at the American College of Cardiology. 76,000 patients of all demographics were examined for cardiometabolic risk. And what they found out, these people had high blood pressure, insulin resistance, and overweight. They were studied in the United Kingdom, the United States, and China. And what they found out was that a plant-based diet resulted in a 20% lower cause of death from any cause, cardiovascular disease, or cancer, whereas the usual diet, non-plant-based, resulted in a 32% increase risk of any cause. That's a 52% difference by following an plant-based diet, which, by the way, tends to be associated with better exercise, not smoking, and so on, because people know they're doing the right thing and continue to do the right thing. This is a picture of people from Ghana. Ghana nationally has the lowest percent body fat. Their diet is 80% carbohydrate. They have the lowest cholesterol intake, the lowest saturated fat intake, the lowest calorie intake, and as just published in Nature Medicine this year, the lowest inflammation in their diet. The Maasai are the proverbial exception to the rules. They are hunters and not gatherers. The previous groups that I showed you were gatherers, much more so than hunters. These people herd cattle, and what they do is they drink a mixture of blood that they nick the neck veins of the cattle, mix it with the milk from the cattle, and then, of course, what's for dinner tonight? Since they are herders, we're having T-bone steak or roast prime rib. They exercise from childhood on. Their blood vessels are enormous, but their blood vessels do have atherosclerosis. It's just that their blood vessels are so large that the atherosclerosis is not sufficient to cause myocardial infarction or stroke. Thanks to Garth Davis for that slide. Now, in 1957 was the beginning of this whole discussion of the 7 countries study. And what they showed was countries with high fiber intakes, low animal protein, such as parts of Yugoslavia and Japan, had a nationally low level of cholesterol. But as animal protein increased, particularly where it was high in Finland, had the highest cholesterol and the highest incidence of myocardial infarction and stroke. Increasing animal protein resulted in the rise in cholesterol. Now, there are people who argue with this study, but again, ultimately, you will make judgments about whatever you read, whether you think it's right, wrong, or indifferent, and that will be based on your education and experience. I am a believer in the 7-country study. Now, stay with me. This is a complex slide. These are the pre-technological societies that I was discussing. Their total cholesterol is 90 to 130. The Kung, the San, the Pygmy, and so on, and the Inuit even, as William discussed, all have total cholesterols of 90 to 130, same as wild primates, same as wild mammals, but here's your average American out here. When this slide was made, the average cholesterol was right at 216, I believe that says. And wow. That was average for myocardial infarction. These 2 slides show that the lower you get the cholesterol, the lower the incidence of myocardial infarction. There is a risk regression to zero concept, and that can be had, as we already discussed, with glucose, and I already gave you the list of preventive numbers. This is for the walking well, where it says if you get the LDL cholesterol, which translates to a non-HDL cholesterol of close to 90, down to 67, atherosclerosis essentially ceases to occur. This is in people who've already had a myocardial infarction or angina, and you have to get the LDL cholesterol lower. This is very old information. You read this number about an LDL of 55 now. That's been known for years and years, but it's just becoming more popular. I like this one. Should I eat more vegetable? Well, let's not jump to conclusion. Here are some pills. As a matter of fact, modern medicine tends to be, what is your problem? You either need this medication, surgery, or physical therapy. Now, this is a meta-analysis of 474 studies. It was called the Cartagene study, C-A-R-T-A-G-E-N-E. And what they showed was that a vegetarian or vegan diet profoundly lowered blood lipids, cholesterol, A1C, triglycerides, non-HDL cholesterol. And once again, we're back to these numbers at this website that you can look up on your own of what constitutes the goal numbers in order to be free from multiple diseases simultaneously. Justification. In 2008, I wrote a somewhat nasty letter to the editor about an article that had been written by some hypertension hotshots and said that they were naive and inexperienced. And the reason I wrote what I did was because I was promoting wrist blood pressure cuffs, where the article was promoting arm blood pressure cuff. Finally, somebody just published a study said that so many people have large arms that the arm blood pressure cuffs are no longer accurate for home use. And so a wrist blood pressure cuff will work on virtually everyone. I don't have any commercial connection, but this brand you can almost always be certain gives you a quality instrument. No matter what version you buy of a wrist blood pressure cuff, it needs to be verified in your office to see that it is accurate. By the way, this is not an acceptable blood pressure. An acceptable blood pressure in the walking well is 110 to 115, over 60 to 70, and in those with hypertension, right about 125 over 80 or less. This is the increasing incidence of diabetes in the United States. And of course, I can say to you, guess why? You already know why. It is diet and percent body fat. This is a particularly complex and profound slide. What it showed was people who had the coronavirus and who had problems. It was related to their percent body fat. Well, everybody knows that. But what it does show is what happens as percent body fat goes up. And you see a rise in cholesterol from 178 at, quote, normal weight with a BMI of 19. That doesn't give you abdominal clear lines of definition and demarcation, but close to it. Total cholesterol rises from 178 to 218, and triglycerides rise from 66 to 111. And remember, each little bit of incremental rise results in an incremental increase in myocardial infarction, and et cetera. But what's most important down here is the rise in the cytokines, which, as you know, created cytokine storm in people with the coronavirus. I don't have a slide that shows this, but people who are vegan vegetarian are generally thinner, but also there is a slide that literally there is data that literally shows that vegans had a lower incidence of coronavirus infection. So look at the rise in tumor necrosis factor from 20 to 56 as percent body fat goes up. Interleukin 6, interleukin 1A, 1B. Prevalence of type 2 diabetes depending upon diet. It turns out that being essentially vegan is your best shot. I do believe that you do not have to be absolutely vegan, and you heard that flexibility in William's discussion. When I talked about the 4 drinks of alcohol, well, you might say you shouldn't drink any alcohol. I believe in being a little bit flexible if people want it. So this gets down to the fact that I believe that if you want animal protein in your diet, we'll talk about that in a minute, that you get as close to this as you can for the reduced incidence of diabetes. What comes with a steak? Cancer, heart disease, and your choice of rice pilaf or a baked potato. I have bad things to say about potatoes. They are essentially similar to the way the body handles candy. Oops. And this is the mouth of a carnivore or even a omnivore. People say that human beings are omnivores. Omnivores do have sharp teeth all the way to the back. Omnivores can safely digest raw, rotten, roadkill meat. Fangs and claws. Take a look at your fingernails. Do you see any claws? Fortunately or unfortunately, you and I are similar to chimpanzees and gorillas. We have four poorly designed teeth called canines. They are actually misnamed, but on the other hand, a little bit of flexibility. That gives you about an 8-to-1 optional animal protein, which turns out about palm-sized servings 3 times a week. Gladiators were 99% vegan vegetarian. They were called barley men because their main food was lentil barley soups. Let me go over that again. These massively muscular people were 99% vegan vegetarian. They ate animal protein the night before they went into the arena. The word burly, which means big and husky, comes from the word barley. They are barley men. Protein is everywhere in the plant kingdom. Such examples, black beans, chickpeas, hummus, red kidney beans, white kidney beans, tempeh, as William mentioned. For those of you who are unfamiliar with it, look into tempeh. It's a little bit better for you than tofu. Being vegan results in a 37% decreased risk of diabetes. And remember, I have to remind you of the sandpaper discussion about motivation. As Kevin Volpe of the University of Pennsylvania showed, as I already said, the stick is more effective than the carrot. Be empathetic, but on the other hand, be honest in order to be protective. This is not a common journal, but on the other hand, it's a legitimate journal. And what they showed was people who eat beans are people who have the greatest longevity. Saturated fat from meat reduces the GLUT4 receptors, which is where insulin gets into the cell in order to handle the glucose. So if the insulin can't get into the cell, the glucose stays in the circulation, goes to the liver, made into increased triglycerides and free fatty acids, which create havoc. Now, this is a major pathway that you really need to become familiar with. Leucine is one of 3 essential branch chain amino acids. In children, they help growth and development, but in adults, they predispose to activating the mechanistic or mammalian target of rapamycin. On the other hand, vegetable protein replaces leucine with glycine and results in the adenosine monophosphate kinase health pathway. mTOR results in plaque accumulation in the body, supports cancer growth, predisposes to insulin resistance. All of that is avoidable by reducing animal protein as much as possible. Improve risk on a more vegetarian Mediterranean diet. As a matter of fact, the Mediterranean diet did not reduce all-cause mortality or cancer. It only reduced stroke. It did not reduce myocardial infarction. So everybody recommending the Mediterranean diet has gone the wrong direction. There is a vegetarian diet, and that one is correct. And the solution to the vegetarian diet is not that you have to stop the olive oil or the omega-3 fish, the salmon, grouper, snapper, flounder, sardines. You don't have to stop those. You just have to reduce them and increase. What you really have to do is increase the vegetables in your diet. William made the point about soups and stews. I give a slightly different definition of soups and stews. Soups are made with more water. Stews are made with less water. And so if you have a very thick vegetable soup, you are having a very filling soup, very filling stew. William taught me the concept of what I call natural Ozempic, and that is vegetable soup at every major meal, whether you eat 1, 2, or 3 meals a day. Begin it with vegetable soup and stew, because that sort of fills you up and makes you less interested in food. And anytime you want, have some warm vegetables sitting around in your kitchen, or have some vegetable soup. Extremely low calorie and cuts down on eating the things that you should not be eating. Plant-based diet reduces kidney disease. The American Journal of Kidney Disease, the National Kidney Foundation, the Nephrology Society now recommends a more plant-based approach for the simultaneous prevention of various types of kidney dysfunctions. Foods exactly as they grow up out of the ground and in the field. The simple word field is the one word I'd like you to take away today. William used the word processed and unprocessed, and I use the word field. So you want them unprocessed in virtually any fashion. That would be oat groats chosen over oatmeal. That would not be standard pastas and so on. The correct idea is grains, vegetables, beans, fruit, nuts, and seeds with an animal protein option if one is trim. Trim is abdominal clear lines of definition and demarcation 5 times in 2 weeks. I know I sound rigid, but on the other hand, there is a price to freedom. Whole barley is how you say whole barley, the equivalent of brown rice, millet, quinoa, oat groats, which I've already mentioned. Drink green tea and white tea, eat the fermented foods that William mentioned, and sea vegetables, which I hope you heard him discuss. Wakame, hijiki, arame, kombu, for instance. All of those can be easily put into soups and stews. And if you ask me later, I can tell you how to make that easy. And this is what our food should look like. The average American male needs around 56 grams of protein per day. The average American eats 100 grams of protein per day because of animal protein. I will give you that animal protein is more satisfying. But on the other hand, you want your freedom or you don't want your freedom. So men, 56 grams of protein per day. Okay, 60, 65. Women, 46 grams per day. Animal protein requires 6 times more energy to produce 1 pound of protein, 7 times more land and water. And this is the way to do it. These are the soups and stews that I said are natural Ozempic. And they contain, note my choice of words, they complain. They contain plenty of protein. And here is more. And finally, we're back to the sandpaper, good cop, bad cop. We've met the enemy and he is us. The first thing to do is wake up and realize that we do it to ourselves. Our patients do it to themselves, and we need to instruct them on the curability. I said it once, I want to say it again. I am shocked that patients come to me and have never been told that their hypertension, diabetes, and high cholesterol are essentially curable. You need to get that across to your patients. Okay? Time for last joke, pre-screen questions, stock answers. And now William made a suggestion. He's going to ask me a question, and I'm going to ask him a question. So, William, go ahead, fire away. What's your question?
Well, I am going to ask you a question, but I thought we might also offer to those joining the call to ask questions previous to our exchange if they would like. And if they don't fill the time, we can certainly do so. So can we open the floor to others? They have
Absolutely.
microphones? Yeah,
Yep.
please.
Anyone?
Bob and Dr. Spear, this is
Mhm.
Michael. So here's a question I have for you. It seems to me like you've made a pretty potent argument that the lower the LDL, the better. I saw someone with a resident yesterday in clinic who's on 80 milligrams of torvastatin, and her LDL was 24. So we had a little conversation. I know this is old data, but there was sort of a J-shaped curve around cholesterol levels back probably when I was a medical student or maybe at residency. It suggests that sometimes if the lipids are too low, mortality goes up. I know some of that had to do with people being cachectic and cancer and the like, but I also think the brain is a very lipid-rich organ. And so I wonder if you might comment on whether or not, whether you believe that we were overzealous in regards to some of our targets, and there are some questions that have been raised about cognitive function being impaired when we are at these very low levels of LDL and